clear aligners are a newer option on the market, and they've actually been around for quite some time, but they've become more popular recently because the pattern that we see with adults that want any orthodontic work or any braces is that they don't want to wear the traditional metal brackets and they don't want the metal to show, and it affects their daily life because of the aesthetics, or they're getting married or they're getting engaged or they can't go to work with metal brackets. So clear aligners are a really good option for patients who have those types of concerns, and they are just clear trays that you wear and they go on top of your tooth structure. They're not fixated on your teeth, so you pop them in and out. And they have these little attachments that blend in very naturally with your tooth structure. So patients majority of the time are very pleased with the aesthetics and the outcome of the clear aligners, and they're very happy with the way that they look aesthetically and the appearance. We usually work hand in hand with our orthodontist to see who's a candidate for clear aligners and who is a candidate for the traditional route of braces or orthodontics, whatever it may be. That's how we usually decide if you're a good fit. So a proper consultation should be set up with your dentist, and we can see if you're the right fit or not. So with clear aligners, the biggest thing is just compliance and making sure that patients are compliant with wearing their trays, because you have the autonomy to take them out. Some people tend to forget to wear them, and they'll go days without wearing them or weeks without wearing them, and then the second set of trays won't fit and so forth. And then that creates, that kind of sets us back with the process. So compliance is usually the biggest thing that I like to advocate to my patients. And tell them, if you're a compliant person and you think that you'll be able to wear these trays day and night, you should only be taking them out when you're eating something that can stain them, like any type of food or like a solid that can stain them, and when you're drinking anything that can also stain them. So water is usually fine, but if you're drinking any sort of coffee, juice, or any sodas, you should be taking them out, and they shouldn't be out more than an hour maximum a day. So they should be taken out in intervals, so when you're eating or drinking, and you wear them at least 23 hours of the day. That's what usually we like to push for the most, because then you'll see the most optimal results. If you start to slack with wearing them and not being as compliant as you think you may be, that's when we don't see the results that we want. The process of clear aligners makes the orthodontic process easier to say yes to, is mainly because of the aesthetics and the appearance. Because they're clear and you don't really see them, they're transparent with the rest of your teeth. People don't really notice that you have anything on, and I think that's the biggest point that people come in for. Like when people come in for clear aligners of any sort, they come in specifically for that reason, because they don't want anything to show, and they're concerned about having braces on or being embarrassed or not feeling confident with the braces. And those types of people will usually opt for the clear aligners because they're more of an aesthetic result. So if you think you're a good candidate for clear aligners, please give us a call for a consultation and we can see if you're the right fit.